Hi, everyone, and thanks for joining. My name is Dave Roth from AvaSure. I'm the Chief Marketing Officer, and I am here today in Grand Rapids, Michigan, where our corporate office and our manufacturing reside. We're going to cover today's topic of investing in nurse retention, how refreshing your hardware can help, and really what this is about. Well, I'll talk about this in just a slide. Before I jump further into the topic, just want to cover some housekeeping. At AvaSure, with these webinars, we try to make this as interactive as possible. And so I do want to encourage everyone on the line today to use the questions feature. If you have questions even during the conversation and the presentation, we'll try to interject and make sure that your questions are answered either during or at the end of the presentation. This is all about having as best of a two-way dialogue as possible. I almost wish we could make everybody on the line a panelist and really share experiences, but that's not feasible. But we'll save time for Q&A at the very end. And so next slide, please. All right, let's talk about the agenda. We'll do some introductions as well. Again, my name Dave Roth. Thanks everyone for your time. On the line with us is Jennifer Williams. Jennifer is AvaSure's clinical program specialist. Jennifer Williams has been a nurse for 21 years with a background in long-term care, leadership, care management, and clinical quality. She's been with AvaSure now for 5+ years. Thank you, Jennifer. Justin Kuipers is up next. He's our AvaSure technical sales engineer. Justin actually started out at AvaSure as an intern in customer care. From there, was hired into the customer care department and is now our AvaSure technical sales engineer. Justin, thanks for taking the time today. And also with us is Chris DeYoung, AvaSure's product manager, waving. Thank you, Chris. He's been with AvaSure since the very beginning, literally. Chris was one of our first salespeople we hired in the organization. He has an extensive background in healthcare technology and brings his expertise now to his role as a product manager. So thanks everyone for team for joining the call. We're going to talk about really how to expand the use cases and really how to expand the value of your current AvaSure program. And we're going to hit on all these topics of key considerations when planning a device strategy, learning about AvaSure's Guardian device portfolio and software options, and also discuss our trade-in and trade-up AvaSure program that y'all can take advantage of. Just doing a quick check. Who's AvaSure? AvaSure is, for anyone new on the call, really we pioneered virtual sitting. We are in the process of pioneering virtual nursing. It's very exciting doing what we're doing. We're in over 1,000 hospitals. We're recognized by Class Research as the leader in reducing care of labor costs. And we have been recognized by this because we have over 120 proven clinical and evidence-based from our customers quantification of how we're making an impact and the ROI savings. And we're focused on what you see on the slide here, elevating care with increasing nurse satisfaction, improving patient care. ROI and labor costs is a key component to every project these days. And I think what is our biggest differentiator is folks just like Jennifer, right? We're with you every step of the way. We understand the clinical side and the workflows of this. We're not just a technology provider, but a clinical technology that will partner with you now and over time. So I already presented the presenter, so I did the intros early. These are the pictures, and we've actually got them in order as they're being presented here, as well as on this slide. So thanks again, team. And next slide, please, Laura. And I think over to you, Jennifer.
Yep, thank you, Dave. So I'm going to kick us off today discussing those key considerations when you're planning your device refresh. So some of the things I wanted to talk about is looking at your current program status. How are you currently utilizing your devices, defining and identifying what your current use cases are and the potential to expand upon those. Also, your current hospital coverage. Are you currently a program that is just monitoring a couple of units? Are you monitoring across your hospital? Is there opportunity during your refresh to include additional things in your program? In addition to that, how much are you utilizing your current devices? If you do have ORNA, or Online Reporting of Nursing Analytics, which is our metric platform, you can utilize your utilization percentage to define how often you're utilizing your devices. If you document or use waitlisted patients when you're maximizing your devices and you have internal data associated with that, you can use that in conjunction with your utilization percentage to define how often you're maximizing the use of those devices and have them in use. Discharging to higher need patients is also a metric within ORNA under the discharge metrics. This helps you to define how many times a month you have actually maximized out your devices and have had to actually triage a patient off to put a higher need patient on. So that kind of correlates with those waitlisted patients and having all of those data metrics together to define how you're currently utilizing those devices. Next slide, please. In addition to that, you're going to want to look at your current device status. Do you have our classic devices or do you have our new Guardian devices, which are shown here? What is the age of your devices? And are those devices still under warranty? Are you able to actively get those devices repaired, or are you having to replace and refresh devices as you move forward? That can be useful in defining, when you are ready to refresh all of those devices and potentially trade in and trade up. Current program goals is also important in conjunction with your current return on investment, or ROI. Are you seeing a reduction in your current sitter usage or cost reduction? And are you seeing a reduction in your falls or improved safety across your program? And if you are maximizing and utilizing all of your devices, is there a potential opportunity to expand along with your refresh so that you can broaden your reach of your program? In addition to that, it's important to look at any additional goals that you might want to add to your program. Satisfaction is a huge part of implementing a telesitter program. Do you want to expand on that and be able to reach a broader audience of your current workforce and also support them in putting staff back out onto the floors and potentially support them through other use cases, which will bring me to my next slide. Considering use cases and potential refresh opportunities when looking at your refresh. So we talked about on the previous slide, identifying and defining what your current use cases are, and then looking at some of those opportunities for expansion. For instance, suicidal ideation. Are you currently utilizing that use case? Is it a potential opportunity for your hospital? Workplace violence and protecting our employees from combative patients. Virtual nurse or telenurse and expanding out to support your workforce through providing additional support through that virtual nurse program. And pediatrics is also a huge growing case. So if you aren't currently monitoring in that area, is that a potential opportunity for you? There could also be other potential use cases that are specific and individual to your hospital that you could define and potentially include during this refresh as well. Another thing to look at is your current hospital-wide coverage. After you've defined where your program currently sits and how many patients that you're currently observing, can you look at other opportunities like your behavioral health units within your hospital or other unmonitored units in your general med surg areas? Could you potentially begin observing in ER or ICU, or is there potential to expand upon those use cases? And also we're seeing a lot of rehab and long-term care in regards to use case coverage. That can be an internal department within your hospital or potentially expanding out to your rehab or long-term care partners as well. Next slide. And of course, before you make any final decisions about refreshing or expanding your program, it's important to know the different types of devices that are available and what is the best device type for your particular hospital and program. So I wanted to touch a little bit on what we typically see with our devices and where we typically see them utilized. So for our mobile one-way devices, we typically see those in the general med-surg areas, rehabilitation units or hospitals, and long-term care units or long-term care facilities. And then we have our mobile two-ways, which is definitely a telesitter enhancement. So if you currently have a program with one-ways, two-ways is a great way to enhance your program and put a personal touch, allowing the patients and staff to see the individual on the other end. And that can be included in a virtual nurse program, adding that to your current telesitter program, or even telehealth and episodic care as well. And then we have our new access devices, which have a very small thumbprint and can be used as an every room solution. So if you're looking at expanding across your hospital and observing in every room, this is a great option, along with our ceiling devices, which can help with reducing the footprint of the mobiles if you have smaller rooms or smaller areas, and have also been seen to be used in behavioral health units for our suicidal ideation type patients, and also in the emergency room and ICU areas. Next slide, please. So I want to cap everything off with considering some other things as well. So when you're looking at refreshing or potential expansion with your program, we want to take other things into consideration, like the possibility of expanding workforce or staffing for your monitor station, or if you're looking at expanding from your current single site hospital to monitoring other hospitals, which we call a hub spoke model. Do you need to hire that staffing? Do you need to increase your workforce? In addition to that, bringing awareness to the change, letting people know what's going on so that we can improve desire and knowledge in those program changes and refreshes. And if you're expanding to other areas of your hospital or outside of your hospital, are you going to require staff training for their ability to work with and run the program successfully? And finally, it's important to look at your policy and workflows so that you can add some additional best practice if needed, and then also add those additional use cases so that your staff have all of the information at their fingertips. And finally, some last minute housekeeping items. If you need additional monitor station equipment, if you have the potential to upgrade your software with AvaSure, depending on the current version of software that you are on, and if your server needs to be updated in order to accommodate the software needs. And I think right now we're going to go ahead and do a poll for anybody listening on the call. And if you could fill that poll out for us, we're going to bring it up. What new use cases are you most interested in expanding to? And your choices are virtual nurse, low to moderate risk suicide, eating disorders, or workplace violence. And we'll give you a couple seconds to respond to that, and then we'll look at the results. All right, so here are the results. So awesome news that we have a lot of participants that are looking at virtual nursing and workplace violence. So that is great to know. So thank you for participating in that poll. And now I'm going to be handing off to Chris DeYoung so that he can elaborate on additional details about refreshing your program.
Thank you, Jennifer, for the great information. We'll get to the next slide. There we go. So just to expand a little bit on what Jennifer shared, health systems are implementing 3 emerging virtual roles that support bedside staff using AvaSure's platform. Dave mentioned the long history with telesitter. So the telesitter monitor can help reduce labor costs while monitoring complex patients. Trained staff can replace the need for traditional one-to-one patient sitters. This can help a lot of different ways. It can help reduce patient falls, prevent violence against caregivers, can prevent patient elopement, can also help monitor behavioral health patients. One dedicated observer can monitor up to 16 patients at once and also provide audio intervention. Lots of different benefits depending on the application. You can dramatically reduce labor spend on sitters, can help increase the quality of care. One example, Trinity Health System calculated 23 million in savings from creating a centralized telesitter team. The next would be the clinical resource telenurse. So the goal would be to offload documentation, the burden giving more time for patient care. This role is typically focused in med-surg. The exact tasks vary depending on the most challenging documentation tasks, but a few examples might include admission and discharge support, patient and family education, consults, and more. Again, lots of different benefits, but it can expedite admission and discharge process, giving bedside staff more than 20 minutes back per patient for hands-on care activities, positively impact HCAP scoring, and can also improve patient flow, which has a lot of different benefits as well. The third is the expert oversight telenurse. So can improve complex patient outcomes and increase nurse satisfaction. Can oversee higher acuity patients or isolation patients with real-time quality and safety surveillance. You can support continuous intervention with audio video technology, allowing eyes on patients and the ability to communicate with bedside staff. Lots of different benefits. It can help novice nurses feel supported with an expert to answer questions, helping to address the experience complexity gap that exists in nursing today. Increase satisfaction of frontline staff, lower retirement rates, can even help prevent failure to rescue in other adverse events. Next slide, please. So the Guardian Mobile. Now we get to do a little deeper dive into the devices, starting with Guardian Mobiles. They're available in either one-way or two-way video options. They give you the flexibility to bring where the need is, knowing that the needs can change on an hourly basis. Some organizations struggle to get a wireless mobile device working in a conference room, even for a demonstration. Our mobile devices are deployed all across North America in every type of wireless environment available. They're extremely durable. They're purpose-built for a tough environment. Both mobile devices come equipped with 360-degree pan-tilt zoom capability, and they have best-in-class audio. And the best-in-class audio is true for all of our Guardian devices. As you all know, audio in healthcare is extremely challenging. It varies from day to day and from shift to shift. And while I won't complain, we've perfected the audio. We have been diligently working on improving that audio for well over a decade now. It not only works, it works really well. The one-way and two-way video options give health systems the ability to not only accomplish the 24/7 continuous monitoring as in a telesitting application, as well as the other virtual care applications that I mentioned. Next slide, please. Guardian ceiling devices. The industry is moving to a device in every room, and our ceiling devices and wall mount devices are both great options. One of the ceiling devices can be mounted entirely in inside of a 2x2 ceiling tile, can be powered over Ethernet. So what that just means is both power and Ethernet come in over the same single cable. It allows for rapid installation, so the installers can get in and out of those rooms quickly. It minimizes downtime in those rooms. There's also a ceiling device that is designed for drywall or hard ceilings. The no ligature design makes it a perfect choice for monitoring patients that might harm themselves or harm others. Next slide, please. Guardian Access device. So we are very excited to add the Guardian Access device to our Guardian lineup. Space is a premium in every hospital, and this device has a ton of features and functionality all built into a very small form factor. The Access device has the same day and night viewing capabilities with the digital two-way audio. Combine that with the ability to connect to a TV via an HDMI connection, and you can start to understand why it's a good option as an every room solution. Next slide, please. Solutions for every room. So a recent study shows that more than 80% of nurse leaders are interested in or planning on utilizing virtual nurses. They want a single enterprise platform that can accommodate a variety of use cases. And we've got just the answer. If you look on the left, you'll see the Guardian mobile device. Again, options for both one-way and two-way. Both provide the two-way audio. In the center is an image of the ceiling device. That's the ceiling tile. Again, we also have hard pan or hard ceiling designed more for the behavioral health type setting. And then on the right-hand side, you see our newest device, the Guardian Access wall mount. Little hard to see, might be a little small, but note the small form factor. Also the connection to the TV using the HDMI connection. Now Justin's going to share a little bit more information on how you can continue to expand your virtual care.
Hey everybody, and thanks Chris for that great run through of the hardware and software offerings. Like Dave so kindly introduced me, my name is Justin Kuipers and I'm one of the sales engineers here at AvaSure. First I want to talk about how AvaSure doesn't just want to be your vendor. We want to be your partner for the long run. And as thought leaders, that's very important to us and to increase that level of patient safety. One of the ways we do that is our flexible purchasing options. So the first one on the left there is Capital Plus subscription. So this is really geared towards the hospital that struggles to get that operational expenditure approval. That can be difficult in a hospital setting. So this allows you to purchase the hardware using capital dollars and then purchase things like support, our Orna data analytics, and software licensing through a subscription or operational expenditure. Next is our more new purchasing platform, which is our full subscription platform. And that's for hospitals that maybe don't want to go through the oftentimes tedious capital expenditure process. And that allows you to put the entire purchase process on an operational expense. And that includes hardware, software, and services, all using operational dollars. So with this process, AvaSure still remains the owners of the hardware, which means you have the ability to do what are called advanced replacements. So instead of having to send a device from your hospital back to AvaSure, back to the hospital for a repair, instead, we're going to send you a pre-configured device. Our customer care team is going to help you get that device online and running. And then you can send that defective device back to us, and that's going to really decrease that downtime that we know we want to avoid so badly. Next slide, please. So next I want to talk about the subscription benefits. Right, so these apply for either model. First is our technology. So technology, hardware, and software. You're really able to pick whatever suits you best. Chris did a great job of talking about our hardware and software offerings, and that kind of blends into what is our clinical strength. With Jennifer is a great example of that. So we can actually have clinical representatives go to your site, get boots on the ground, and really understand what devices you need and where, and really get a great idea of your goals and where you want to go. And that is one way that we're able to use our clinical strong arm and really help you achieve what you need to achieve. Next is data. So when you're going to be a part of the subscription program, you have full access to Orna and all the data analytics, and Jennifer is going to share a little bit more about that. And then next is one that I'm personally really proud of, is our 24/7 by 365 support. Like Dave mentioned, that was where I got my start here at AvaSure, and I'm very proud of the team that we have over there in customer care, and they're there with you every step from day one forward, working with you to overcome any technical hurdles or challenges that you might face. Next slide, please. So next I want to talk a little bit about kind of a 30,000-foot view of our trade-in program. So first, we're going to talk about goals. We're going to understand what you need, where you want to go, and let's look at the long term, and let's really start to build out a plan on how AvaSure and your facility can partner to best suit your needs. Next, we're going to talk about subscription options. Again, whether or not you want to go with that Capital Plus subscription, or if you want to get on a full subscription program. And then once we have that locked in, and we've got all the devices chosen, then you're going to receive your new devices. Our implementation team is talented. They're quick, both in clinical education and in our technical deployment. And they're going to help you get those devices unboxed, set up, added to the application. And then as soon as those devices are up and running and your VMTs are ready to go, those old devices are going to come off of the application. And then our implementation team is going to help you get those boxed up. And then step number 4, return those devices back to AvaSure for your trade-in credit. Next slide, please. So this slide really, nails the point home here. This is what you can expect day 1 after you've expanded your virtual care platform. So again, we're improving that nurse satisfaction. We're increasing patient safety. We're allowing, we're expanding your ROI right away, and all that's on day 1. So next, I'm going to pass it over to Jennifer, who's going to talk to you a little bit more on your customer success resources.
Thanks, Justin, for that deeper dive into the different opportunities that sites have to make choices on what types of subscriptions they use. I wanted to cap things off with reminding you of our AvaSure customer success resources. Justin touched a little bit on the data that we have available through Orna. All sites who purchase our devices regardless do have access to our AvaSure administrator panel or 24-hour live dashboard. And then we also have Orna, which is our online reporting of nursing analytics, which captures all of your data trending for your program. You may or may not have that option at this moment, but just so that you're aware that you can leverage data from your 24-hour live dashboard and Orna to assist in a better understanding of the current state of your program, uncover any performance initiative needs, and define that device utilization threshold for your program while maximizing your program potential and identifying the need to refresh or expand. And through our AvaSure customer success team, which includes a group of nurses and other support teams, we're happy to partner with you to strategize, look at program performance and improvement needs, and define your best excellence in your program while working with you on return on investment and identifying when you're ready to expand or refresh your program. And so now I'm going to hand it back over to Dave to close out the presentation.
Thank you, team. Nice job. We left some time for some Q&A at the end. So I do want to encourage folks that if you have questions, we got 2 or 3 here already, please go ahead and enter it. There's a questions drop down in your GoToWebinar control panel, if it's called that, for all of you attending. You can go ahead and enter your question, and we can talk to these things live. While you're doing that, Laura, it's the time now to go to the next slide. I do want to mention and highlight, we're seeing the most questions these days around virtual nursing and a lot of what's evolving. In fact, one of our questions is the fact, and Jennifer, we'll start with you, the fact that we're starting to work on virtual nursing. There's questions around what use cases are most common, and I do want to ask what results we're seeing, you're seeing, Jennifer, as it relates to virtual nursing. Before I hand that off, realize we have a virtual classroom webinar series that talks about the role of the virtual nurse, introducing the clinical resource telenurse model. These are sessions we've already run. Those are recorded and those are available on avasure.com. And there's 4 more sessions about the business case and the other titles that you'll see here on this slide. So please keep those in mind, come to our website for more information. But Jennifer, back to you. Really, can you respond to this first question around the results we're seeing with virtual nurse and so forth?
Absolutely. So virtual nurse is definitely the new buzzword. So we are seeing more and more sites want to take advantage of implementing virtual nurse programs adjacent to their telesitter program. Some of the use cases that Chris touched on, the expert oversight nurse, so utilizing those seasoned nurses to help respond to and be available to your more novice nurses. But some of the main use cases that we've seen and that have actually seen some given results on are the resource nurse, where you can have them assist in admissions, discharges, and providing education to your patients. You can potentially see a 12-minute reduction to your admission process, up to a 29-minute reduction to your discharge process. And we've also seen between 25 to 70% reduction in code blues with the virtual nurse programs that we've seen going up in live. So definitely some opportunity there to improve upon what you're seeing in your hospital in regards to resources and getting patients in and out of the hospital timely and reducing hospital stay times.
Fantastic. Thanks, Jennifer. I do also want to highlight, if you're just getting started with exploring virtual nursing and the benefits, we did a stellar symposium last year with a bunch of recorded sessions. Those are all available out on our YouTube site, as well as available through our website. And so please visit those for more information. And you know, I also wanted to mention that as we visit our own customers in different use cases, we see you know, an interest to learn more experientially. I was out at a site where they're actually using a two-way device in various nurse cases, and if in their own words, if they can see value, even just the admission process and the time it takes to gather med recs and do other things and free up the bedside nurse, there's huge wins. So different folks are exploring different use cases, and we're happy to share more information as we go. So the next question up, and I think this is going to go back to you, Jennifer. What metrics or which metrics are you using to justify the investment in refreshing these types of programs?
Oh, absolutely. So that's a great question. And important to know that if you are not already tracking internal hospital data along with your AvaSure data is a great way to start off your program on a good footing, and to make sure that you're able to recognize the changes and improvements that you're seeing as your program moves forward. So there's multiple metrics that you can look at in those fall metrics that you have within your internal hospital data, including falls on telesitter, falls off that occur off a telesitter and off of one-on-one sitter with no intervention at all, falls with injury and your total falls, and then also looking at your sitter hours as well. And you can also split those into behavioral health hours and non-behavioral health, depending on your use cases for your telesitter, and then combining those with your AvaSure ornametrics to define where your program is at, where you're at in maximizing your program, and how you're impacting your return on investment with your program. And AvaSure is also happy to partner with sites to help define that ROI and to make a business case for expanding upon or refreshing your program if needed.
Got it. Thank you for that. There is a question here, and I'm sorry, I'm not mentioning who's asking it in case you want to this be kept in confidence. But there's a question in terms of can devices be connected to private cellular wireless networks? So Jennifer, you get a break. Over to Chris DeYoung, Justin from a technical side. But Chris, can you share your thoughts?
Yeah, certainly. So historically, because it has to be up all the time, continuous, and because of the importance even during episodic, we've traditionally focused on the wired and wireless networks that provided the best connectivity. As things continue to progress where cellular is more reliable, we'll certainly work towards providing an option there. But right now, it's just the wired and wireless networks, not cellular. Good question.
Thanks, Chris. And I think the great point is that whether the Guardian access device is mounted near a screen, a television, or if it's ceiling mounted, or if it's positioned from one room to another, these are considered really fixed, in the room, not that they need to gain connectivity as you go from room to room, because they will be going from patient to patient. Okay, so I'm doing a quick scan to see if there's any other questions. Justin, I guess there's one here for you in terms of will there be downtime to a program if there's a swap, if there's trade-in of devices? How do we manage that?
Yeah, I can confidently say no. Yeah, our implementation team does a great job making things as smooth and easy for the hospital as we can. And one of the important things there is no downtime.
Awesome. Well, I think that's it for questions for now. I don't see anything else. I'm doing a quick check of my iPad here. I'll wrap it up by saying that if you're interested in starting the trade-in program, reach out to your rep, hit marketing@avasure.com, info@avasure.com, give us a call, contact anyone that you see here on the screen. We'll be happy to help you all. So I hope you found this useful information and helpful in terms of thinking through your next step, and as you evolve, the value and use cases that you're building into your AvaSure program. And thank you all for your time. Thanks, team, for sharing all this great information.